Good evening, class. Today I will discuss an ethical dilemma that occurs with a macro level social work setting and explain how I will approach the situation using Reamer's ethical decision-making model. This dilemma highlights the challenges social workers face when organizational policies and funding requirements conflict with professional values and ethical responsibilities. Introduction to the ethical dilemma. I am serving as a program administrator at a large nonprofit organization that provides housing assistance and case management services to low-income individuals and families. I work with seniors, the senior population that I work with. And recently the organization received an opportunity. Recently, the organization received the opportunity to receive a grant from a private foundation that will significantly expand services and improve financial stability. However, the grant includes a condition requiring the organization to prioritize assistance for families with children and at least one employed adult. This means that unemployed individuals, childless households, and many chronically homeless adults would be excluded from receiving services funded through this grant. This creates a significant ethical dilemma. On one hand, accepting and implementing the grant requirements would provide much needed. And this can help with all the grants and all other services, funding, and allow the organizations to continue by serving most of the clients. On the other hand, people experiencing long-term homelessness and those facing systemic barriers to employment. As a social worker, I must decide whether to comply with the funding restrictions, advocate for my clients, hear and listen to what their needs are, to help them resolve and modify a few ethical dilemmas, alternative solutions that will align more closely with social worker values. And most of the several important as a social worker. First is the value of service, which encourages social workers to help people in need and address social problems. Second is social justice, which requires the social workers to challenge discrimination, inequities, and barriers that affect vulnerability populations against. And the third is the value of dignity and worth of the person to treat with dignity and respect, with which emphasizes to all individuals and all clients with respect and recognizes their inherent value, regardless of the employment status or family composition, no matter if they're low income or not, whether they have funds or not. It's important to treat them with dignity and respect. At the same time, there's an organization obligation to maintain financial stability and ensure that services that remain available to as many clients as possible. Refusing the grant may reduce resources available for numerous families who need assistance. Therefore, the conflict exists between protecting agency sustainability and ensuring equitable access to services for the vulnerable population. Who can be impacted in the diversity? Multiple clients groups will be affected by this decision. The first group includes clients that will likely benefit from expanded housing assistance and increased case management services by linking and referring the clients to where they can benefit for more assistance, for more grants, for more stability. The second group includes unemployed individuals and families who face significant barriers such as disability, mental health illness, lack of transportation, and provide them, for example, access transportation, maybe rides through their insurance, through their Medi-Cal, limited education, discrimination, or caregiving disabilities by including IHSS helpline and help assistance. And the third group includes chronically homeless, single adults, those that are experiencing or can be considered for FSP. Single adults who already experience reduced access to housing resources and support services are the most that are impacted the most. These excluded populations are often among the most vulnerable members of society. By limiting access to services could increase the housing stability. How I was explaining earlier in my essays and during my class, the NAS Code of Ethics provides important guidance in this situation. And the first relevant standard is the ethical principles that we as social workers present as social justice, which states that social workers challenge social injustice and pursue social change on behalf of vulnerable populations, but advocating for these people, advocating for the society and humanity that it's standing in today's society. And the first relevant standard is the ethical principle of social work, social justice. The second is the principle of service, which emphasizes helping people in need and addressing social problems by assisting and providing all the resources that we can, as these individuals are in need of support. Another applicable standard is the 1.01 commitment of clients, which states that social workers primarily responsible and promote the well-being of clients. As I was explaining earlier, how do we advocate for these people? Another standard ethical from NASA is a social and political action. Encourages the social workers to advocate for equal access to resources and opportunities. As I was explaining earlier, the linkage and referral is very important, such as transportation, housing, funding, anything that includes advocating for these clients. And finally, the standard of administration, who states that social work administrators should advocate within and outside their organization for resources needed to meet clients' needs. Me as a worker, I advocate for my clients. I find resources as much as I can. Try to limit the stress reduction to help them exceed what they need. Because they're people that have been forgotten and probably don't have family members to support them. But how do we apply this? How do we apply this Reamer ethical decision into our criteria? By identify the ethical issues. The primary ethical issues is whether we implement the grant requirements that would unfairly. Also, to identify, we identify the stakeholders, families with children who will benefit from funding, unemployed individuals and families who will be excluded, homeless adults, agency staff and administrations, a private foundation providing funding, community partners to the broader public. And most importantly, the review and ethical standards. At this stage, I will carefully review applicable NASA ethics standards agency policies and also consult with others. It's important. Considering the possible courses of the action by several options existing. Option one is fully implement the grant restrictions without challenge. Option two is to decline the grant entirely. Option three is to accept the grant while advocating for the modification of this funding resources to remain available for all these clients. And option four is to seek supplement funding sources to specifically target towards populations that would otherwise be excluded. Evaluate the risk and benefits. How do we implement those grants and screening would increase services, but potentially cause them harm to exclude clients? Rejecting the grant would preserve the ethical. Also, make and implement a decision. After evaluating all those factors, I would recommend accepting the funding while stimulating pursuing policy modifications and alternative funding streams by monitoring the outcomes. And finally, I would continuously assess the impact of the policy and affect clients and evaluate by going back and revisiting what has been happening. The role and the responsibility of the social worker. As a social worker and administrator, my responsibility extends beyond that. I have the ethical obligation to advocate for the clients. The NASA Code of Ethics requires social workers to balance obligations, and that's what I'm here for, to advocate and organize for the society that those people that are in need, while I must consider the agency's financial needs, I cannot ignore policies that at disadvantage already by the population. But in conclusion, this ethical dilemma involves balancing agencies sustainably with social work commitments to equity and vulnerable populations. Using Reamer's ethical decision-making model provides a structured process for analyzing competing responsibilities and then identifying ethical solutions. As a social worker, we must advocate for clients while working with organization realities. And that's what I'm here for. As a social worker, I will advocate in behalf of my client. I will make all the efforts that I can to help and support whatever I can if it's under my power. Ultimately, the decision like this affects organization trust, community relationships, and long-term client outcomes by grounding our actions in the client outcomes. By grounding our actions in the NASA as a professional values, we can make decisions that support both. Thank you for listening, and this is the end of my presentation. Good night.